Hello everyone. Already we studied about the general anesthetic in previous lecture. Today we will see about the next intravenous general anesthetic propofol. Already we studied about the intravenous general anesthetic sodium thiopentate. So today we will start with propofol. So propofol used in daycare surgery. It is used in the daycare surgery, but it is painful when compared to other drug. So what is mean by daycare surgery? So if we have done surgery and same patient we have to send on a same day, or that's second meaning is that we don't want to admit that patient, okay, for a few days. We don't want to admit that patient for a few days, so we have to send patient on the same day. Okay, we don't want to admit that patient. That time we used a general anesthetic. So it is the daycare surgery general anesthetic propofol. Okay, and how to remember this other daycare surgery general anesthetic? By using a trick like Dr. Manmohan Singh is a prime minister. Okay, for D for disflurane, M for midazolam, S for sevoflurane, I for isoflurane, A for alfentanil, P for propofol, and M for mucurium. So that is the hint to remember general anesthetic, but those general anesthetic used in the daycare surgery. So this is about the propofol used in a daycare surgery. Next, ketamine. So next intravenous general anesthetic is the ketamine. Ketamine we also call the dissociative anesthesia. So here also how to remember ketamine? So itself name, K for kids, E for emergence reaction, T for thalamocortical junction, A for analgesic effect, M for meals, I for increase in pressure, M for N for NMDA receptor antagonist, and E for excellent bronchodilator. So one by one we learn about uses. K for kids, that is the ketamine used in the children's to produce the anesthesia. Next one is the emergence reaction. So what is mean by emergence reaction? So when anesthetic give ketamine, or we have give ketamine, so patient become unconscious. Okay, patient become unconscious, but when after some times when a patient become conscious, that time he will feel or he will get some CNS side effect. That's those side effect we call emergence reaction. What is mean by emergence reaction? When we have given ketamine and patient become unconscious, but after some times patient become conscious. So during recovery he feeling or he will get some CNS side effect. That CNS side effect we call the emergence reaction. The next use is the thalamocortical junction. So here is the two region. One is the thalamus and second is the cortical, that is the cerebral cortex region. So general anesthetic acting on the thalamus region, then they produce the analgesic effect, or it shows the analgesic effect. But when it acting on a cerebral cortex region, it shows the or it produces the anesthesia. So general anesthetic when acting on the thalamocortical region, it shows also first one is the analgesic effect due to acting on the thalamus region, and also second one is the drowsiness when it acting on the cortical region. So due to both side effect, analgesic effect and drowsiness effect, patient feeling like I am not in this world, out of this world. That anesthesia we call the dissociative anesthesia. Okay, then next one use is the analgesic effect. Analgesic effect, analgesic effect. Next is the meals. Most of the general anesthetic we give with the empty stomach, but ketamine take with a full stomach. Next use is the increase in pressure. So ketamine increase the pressure. Okay, increase the BP, increase the intraocular pressure, then increase the intracranial pressure. So, what condition where the BP is low or patient goes into the hypotension? So, shock is the condition where the patient goes into the hypotension. That time we use the ketamine to increase the BP. But second condition is the ketamine also increase the intraocular pressure. So, intraocular pressure it increase due to increased secretion in the eye. Okay, and that time that condition we call the glaucoma, where the secretions are more, and due to secretion there is an increase in intraocular pressure. So ketamine is contraindicated in glaucoma. We don't use ketamine in intraocular pressure disease like a glaucoma. Next use is the it is used to increase the intraocular pressure, but intraocular pressure or intracranial pressure increase. Intracranial pressure increase in head injury. So also there is a ketamine is contraindicated, because in head injury if cranial pressure is increased, so it produce the complications. Okay, next use is the NMDA receptor antagonist. Ketamine is the NMDA receptor antagonist. Excellent bronchodilator. Excellent bronchodilator. We know that in our respiratory system, trachea, bronchi, bronchioles, and the alveoli. Okay, alveoli function is to exchange gases with the blood. Okay, and blood from the blood it goes to the brain. Okay, so it is excellent bronchodilator. That means when the bronchi get constrict, that time we use the ketamine to for the bronchodilation effect. So this is about the ketamine. So once again I repeat here. First is the propofol used in a daycare surgery. Okay, daycare surgery means ज्यावेळेस आपण एखाद्या पेशंटची सर्जरी करेल आणि त्याच दिवशी सेम डेला आपल्याला त्या पेशंटला डिस्चार्ज येत असेल. ओके, आपण त्या पेशंटला ॲडमिट करू शकत नाही, त्या वेळेस आपण प्रोपोफॉल यूज केलं, त्यावेळेस प्रोपोफॉलचा यूज केला जातो ॲज अ डे केअर सर्जरी. ओके, आणि आपण कसं लक्षात ठेवू शकतो तर बाय युझिंग हिंट. डॉक्टर मनमोहन सिंग इज अ प्राईम मिनिस्टर. ओके, D for desflurane, M for midazolam, S for sevoflurane, I for isoflurane, A for alfentanil, P for propofol, and M for mivacurium. Next, intravenous general anesthetic is the ketamine. Ketamine is the dissociative anesthesia also. Okay, so K for kids, it is used in the kids, that is the children. E for emergence reaction. Okay, emergence reactions means the जेव्हा आपण जनरल ॲनेस्थेटिक देऊ केटामाइन, त्यावेळेस पेशंट काय होतो, अनकॉन्शियस होतो. पण ज्यावेळेस काही वेळानंतर तो पेशंट कॉन्शियस होतो, पुन्हा शुद्धीवर येतो, त्यावेळेस त्या पेशंटला काही CNS साईड इफेक्ट जाणवतात. ओके, ड्युरिंग रिकव्हरी त्याला CNS साईड इफेक्ट जाणवतात, त्याला म्हणतो आपण इमर्जन्स रिॲक्शन. नेक्स्ट यूज आहे थॅलामोकॉर्टिकल जंक्शन. थॅलामो म्हणजे थॅलामस रिजन, कॉर्टिकल म्हणजे सेरेब्रल कॉर्टेक्स रिजन. ओके, आणि जेव्हा जनरल ॲनेस्थेटिक थॅलामस रिजनवरती ॲक्टिव्ह होतो, तेव्हा तो काय दाखवतो की ॲनाल्जेसिक इफेक्ट दाखवतो. आणि जेव्हा कॉर्टेक्स रिजनवरती ॲक्टिव्ह होतो, तेव्हा तो ड्राउजीनेस म्हणजेच पेशंटला कसा बनवतो, तो अनकॉन्शियस. म्हणजे दोन्ही इफेक्ट झाले, ॲनाल्जेसिक इफेक्ट अल्सो आणि ड्राउजीनेस इफेक्ट अल्सो. त्यामुळे पेशंटला काय होतं की फिलिंग्स लाईक